Okay, Ken. So, can you introduce yourself? Can you formally introduce yourself? What is your story?
Sure. Yeah. So, Teresa, I'm glad to be here, and thank you for having me. So, my name is Ken Coelho. I live in the San Francisco Bay Area. I've lived here for about close to about 20 years now.
Yeah.
And my family and all my friends and my whole network are in the area. I grew up in the Middle East, in Bahrain, where I was born, and have lived in India, the Eastern Europe. I've lived in Romania. I've also lived in the United Kingdom, and now in the US.
That's
So,
very interesting. You're quite worldwide, aren't you?
yeah.
Okay. So, what led you to join LIGS University?
Well, I think my first interaction with the university was with some of the administrators who were really interested in looking at incorporating health sciences, public health
Mhm.
with the curriculum, because as you know, recently we've seen the global pandemic and we've seen the global impacts that the world has had to incorporate, both from an economical standpoint, but also from a social and political standpoint. As health and healthcare really impacts everything in society,
Yeah,
both
definitely.
yeah. And so, so what I liked about LIGS is that the program is flexible and allows students to really immerse themselves both in the general aspects of management and operations on the business side, but then also incorporate elements of their interests for electives such as the public health or global health specialization. So I think that the flexibility that LIGS allows will provide me an opportunity to expand my student base and really meet a lot of new folks who are interested in specialization.
Perfect. Yeah, I completely agree with you because public health is such an actual issue right now, and the timing is quite perfect for LIGS University because we are trying to promote online education for 15 years. We were established actually 15 years ago. We are going to have an anniversary in February, like in 14 days. So this is a big year for us, and also for global public health. And I'm very happy that we are going to make this happen now. Okay, so you are yourself a very successful manager and director, and you achieved all of that in such a young age. Can you tell us what is a basis for a successful enterprise?
Sure. So it's interesting if you mention successful because successful can be very contextual based. I think success for a lot of folks can mean very different things. So as I mentioned to you, I was born in the Middle East and I grew up both in Bahrain and in India. During that time, my father was a physician practicing medicine both in urban and underserved rural areas, both in the Middle East and also in India. So I grew up with our house becoming sort of like his clinic where he would see patients. So that kind of has impacted sort of my career in healthcare, my career in public health. I bring that background into my work every day. And so in most of my roles, actually, I have been serving underserved communities. And so I think what really makes a good director manager enterprise or in an organization is staying true to the mission, vision, and values of the organization. And then also understanding that, being able to bring your true authentic self into those interactions, because then you're easily equipped to build successful relationships. And that ends up translating to getting the right people at the table to make those decisions. And then being able to really work with a committed group of individuals that push the equation on making improvements. For example, in my current role, I get to work with a lot of the future generation of physicians who are training in their residency programs. A lot of them are going to become world-class trauma surgeons or even world-class hospitalists. So being able to have that impact right at the training level makes me feel very happy, content, and empowers me to really try to find sort of creative ways of imparting medical education. Yeah, I'm not sure if that answers your question, but it goes back to really staying true to your values
Mhm.
and understanding where you as an individual are coming from, and then incorporating your background into your decision making. And it comes out as being authentic, true, accountable, and transparent.
So you're quite answering my next question, which is what makes a good manager? Is it a complex package?
So in order to be a good manager, you need to at least have the basic skills, of knowing how to perhaps conduct some sort of analysis, be able to communicate sort of in a way that allows your ideas to not just be out there, but also ideas to actually be executed, right? So you bring a team of individuals together to help execute on your ideas. So I'd like to classify them into two types of pieces, right? So you need your sort of technical components, right?
Mhm.
To being a good manager, and that comes with a whole technical toolkit, so to speak. And then you
Definitely.
need your kind of soft skills, which is, I like to call the more emotional
Mhm.
aspects of being a manager. Back in the day, there was a book called, I think it was Emotional Intelligence, and what do you need to make a good manager, right? And so this concept of emotional quotient came out in that book. It's like kind of like similar to intelligence, your intelligence quotient. There's an emotional quotient as well. And so a lot of the times we forget that, being a good manager also entails having those soft skills, having, good self-awareness, having great communication skills, having to read between the lines during a discussion and understanding, perhaps there's something else going on here. It's not just the topic that we're discussing, but
Mhm.
maybe it's striking a chord with this person. So being able to have kind of honing in on those like nonverbal attributes of emotion, like your facial expressions, your vocal tones, how you're communicating. It's not just what you're communicating, but how. So I think, those are some of the elements that people tend to forget that make a great manager, a great director, a great leader, because
Definitely.
that then helps you push the bucket on not just being a leader, but then
Mhm.
being a transformational leader.
Definitely. That was put really right, and I completely agree with you. So, we've touched this topic a little bit, but would you say that it was your true calling to be a manager?
Yes, I truly believe that to be the case. And I've always got a lot of pleasure from helping people. Even before my professional role as a manager, even when I was a student in school,
Mhm.
I would actually put together study groups for a group of students when we were having trouble, say, in statistics or in algebra math class. I
Mhm.
put together a small study group and a schedule for us to meet after class so we could help each other as a group.
Mhm.
Over the years, I tend to also do that. I've done that, I continue to do that in both my academic training and now in my own professional job. I tend to create those micro communities where everyone can help each other because we all have skills in different areas. And some of those areas can be strengths for us, but for other people, it might be a weakness. And so, if I can share with you some of my strengths and if you can share with me some of your strengths together as a community, we can actually, get a lot further in both in our education, but also in our skill set. So a good manager, and I like to say I am a person that can bring communities together. And that's what makes me a good manager.
Yes, bringing communities together is a thing that is very connected to the whole issue of public health. It's not a secret that we are preparing this specialization. So I would like to talk now a little bit about the importance of learning public health and why is it needed in the first place. Can you share something about this?
Right. Yeah. Study of public health really is about understanding what is it that makes up a community from its very foundation.
Mhm.
Okay. How does the elements of the community both may strengthen the foundation of the community or it might weaken it? So it's really understanding how do we really assess what that community is? And then once we assess what that community is, how do we then make targeted improvements
Mhm.
to the community? So there's a sort of a health assessment phase in the study of public health, but then also kind of like an improvement phase, where you are conducting analysis, investigation, and focusing on a specific area. Now, when you take public health in a global context, you're beginning to not understand a community and understand how communities together function.
Yeah, I definitely wanted to say this, that now more than ever, we should be aware of the fact that there are no separate communities. We are together in this world, and we are one big community, and everything with globalization, it's such important thing to know that we are one global community.
Absolutely. And the pandemic has actually shown that, geographic boundaries don't exist anymore.
Don't exist anymore.
Yeah, we live in in a global context. And so the global determinants of health has now become even more important. We normally talk about the social determinants of health. It's sort of like the community that you grew up in becomes the community that then defines your health, defines your health access, defines your health vulnerabilities, defines your health promotion aspects, and also defines ultimately if you die earlier in your life. So now when you take that social determinants of health and you extrapolate it to the global economy, you begin to take and try to understand how we as a global institution are now being influenced by the social determinants of health. And so that's why I like to call it the global determinants of health.
Yeah.
So yeah, it is extremely important to understand public health, and I think everyone should have some basic foundation of public health, foundation of global health, and even to be able to communicate across global boundaries now. As you know, we independently have specific languages, right? In Czech Republic, we speak Czech. In India, we speak Hindi. In the Middle East, we speak Arabic. But even though there are sort of separate languages, we have to understand that there's a lot of similarity between the languages.
Exactly.
And then you begin to look at, nonverbal aspects of communication, as I said earlier, like your facial expressions, your vocal tones, and how you speak. A lot of those attributes sometimes are universal in nature. Me raising my eyebrows could mean sometimes different things in different contexts, but most of the times it could mean the same thing too. So, but even that global health communication, I think is becoming global communication is becoming even more relevant now. So, having sort of basic elements, basic understanding of it, and being able to also incorporate that into your professional work settings.
Exactly. So I would like to highlight that even though you are currently based in the United States, your service will be heard everywhere around the globe. It's perfect. There is one side to the pandemic that the borders don't exist anymore, but there is also a good side to it, that you can help from one place in another far, far away. Okay,
yes.
So.
Yes. Yeah. And I'm actually very excited about that, because having a global reach, from an academic standpoint, but also being able to influence ideas and thoughts and opinions and academic discourse, I think is amazing.
Definitely. I completely agree with you. And this is a good thing about LIGS University, that we although we operate from one place, we can have impact in another, and that's really great, I would say. Okay.
Yeah, so I'm really excited about that piece, because a lot of my academic commitments have been localized to specific communities, and I think with LIGS global outreach and flexibility, I will be able to reach out to communities all around the world, parts of Africa, in parts of Southeast Asia, and parts of Europe, that I've never been able to, not to this extent, to interact with. And so I'm really looking forward to that interaction, to the discourse. And, as a lecturer, as a professor, you also learn so much from your students. And so I'm really looking, forward to that, and I'm super excited about that.
Awesome. So, but enough about the LIGS University. Let's now talk about you in person. After accomplishing such success What is your recipe for success, and what would you say to your former and to your future self?
So if I had to speak to myself from years ago, I would probably say educate, 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 because there's never enough education you can ever get.
Mm-hmm.
And try your best to immerse yourself in knowledge, because what you may have learned 10 years ago may not be relevant 10 years later. So you have to be a continuous, constant learner throughout your life. So I would say being lifelong continuous learning is number one. And then number two is don't be afraid. Don't be afraid to take risks, because it's okay to take a risk and fail. Because the more often you fail, the more likely that you will learn from the failure and succeed in the future. When I was early on in my career, I would always try to take easy classes in university just because, I want that A grade. But as I advanced in my career, I started to tell myself, no, don't just take easy classes. Take the tough ones. Take a risk. And if you fail, you fail. And take it again. Take another class. Learn from the failure, and
the challenge brings you forward.
Yeah, in healthcare also we tell ourselves, fail soon, and fail often, because the more you fail, that helps learning, both from an organizational standpoint and also from a departmental.
No, this is interesting because I had another interview a few days back. And it was with the director of Linet Group, if you're familiar with it. And he's from the Czech Republic as well. And he said the same thing, completely the same thing. So I would say that this illustrates your point about that we all speak the same language, or at least we have the same thoughts and so on. Okay, so do you have any other recommendation as a key for success for our audience?
Yeah, I mean, I do think, another key to success is to stay optimistic and stay hopeful. Because, a lot of the times we bring ourselves down with everything that's going on around us. And I think it's important to recognize that there is a lot to look forward to. A good example is, a lot of people have given birth to new life during the pandemic. People have had new kids, babies, and new life has come into the world, just as much as as life that has been taken away. But I do think that having that hope and optimism is good. It keeps us energetic. It keeps us alive. It keeps that flame burning. And so I want all our audience and students to think along those lines.
That is such a positive note to end with. Thank you very much.